All right, let's talk about TRT safety for both men and women. Not the hype, not the fear, but the data that tells the real story. Testosterone is one of the most studied molecules in all of modern medicine. Over 100 years of research, thousands of clinical trials. That's a lot of data. It's not experimental, it's not new, and it's not unknown. Testosterone is a hormone that your body has been producing for a very, very long time. And there is no compound on the planet that your biology recognizes more naturally than one that it already makes. And yet, we still find ourselves in this environment where TRT is surrounded by myths. So let's talk about two of those myths, and then let's talk about what some of the data shows about what it actually does for you. The first myth is the cardiovascular, and it's probably the most prominent myth. For years, doctors told men that testosterone caused heart attacks. That fear came from a lot of studies, but one in particular in 2013 that was later retracted from clinical guidelines. And if you know anything about clinical studies, when something gets retracted, not only was it wrong, but it was really wrong. So the definitive answer came in 2023 from the Traverse trial, 5,200 men with low T and pre-existing cardiovascular disease. It was randomized, double-blind, and placebo-controlled. And the result was very, very clear. There was no increase in heart attacks, strokes, or cardiovascular disease. And here's where it gets even more interesting. TRT isn't just cardiovascular neutral, it's actually cardioprotective. And what that means is the exact opposite of what they've been telling you. A 25-year meta-analysis published in 2024 found that testosterone replacement therapy, and again, we're talking about TRT, we're not talking about steroid use of all other substances at super high levels. TRT was associated with a reduced risk of major adverse cardio events, particularly in men with pre-existing cardiovascular disease, diabetes, or metabolic syndrome. Now, the mechanisms how this work are well documented. You have improved endothelial function, better vasodilation, lower systemic inflammation, reduced visceral fat, improved lipid profiles, and better remodeling after injury. What does that mean in a sentence? Well, it means your heart is stronger. The men who actually have the highest cardiovascular events, the highest rate of cardiovascular events, aren't men on TRT, they're men with untreated low testosterone. Interesting, the opposite of what most of us have been told. The prostate cancer myth is the second big one. This one dates back to a single patient, literally one. A 1941 study established that belief that testosterone fuels prostate cancer. That was a single patient study. That was the foundation of 7 decades of medical fear. There's a doctor at Harvard, his name is Dr. Abraham Morgentaler. I always mess that up, Morgentaler. Spent pretty much his entire career re-examining the data. His work and dozens of other subsequent studies as a result of his work have shown that men on TRT, again, when properly screened and monitored, do not have higher rates of prostate cancer. The mechanism how this works is called the saturation model. Prostate androgen receptors get fully saturated at relatively low testosterone levels. So adding more testosterone above that point does not accelerate prostate cancer the way that decades of medical dogma assumed. Again, this fear was based on one patient, and the data, which we have decades of, does not support that claim whatsoever. Now, we all know about some of the things that TRT will do for you on the surface, right? Better energy, better mood, increased muscle, slows down the aging process, better libido, and there's a long list of other things. Some of the things that people don't talk about are equally as important. One of those is bone density and fracture prevention. Most people don't think about their bones until they're much older and they break one. Testosterone is essential for bone mineral density in both sexes, men and women. Men with low T have measurably lower bone density and significantly higher fracture risk. Hip fractures in elderly men carry a 1-year mortality rate higher than most cancers. So when you break your hip and you're older, it's pretty much a death sentence. And I think we'd all like to avoid that. The NIH testosterone trials enrolled 790 men, 65 and older. 1 year of testosterone treatment significantly increased bone density in the spine and the hip. And this was backed up by DEXA scans and everything. And that can be life-changing for an elderly man. For women, testosterone plays a smaller but still essential role. Women with higher testosterone have better bone density and lower fracture risk in midlife and beyond. Now, that's not a vanity issue. Stronger bones mean a longer and more functional and better, more enjoyable life. Type 2 diabetes and insulin sensitivity is another thing. This is probably one of the most overlooked benefits. A third of men with type 2 diabetes have low testosterone. The Times 2 study showed that 12 months of TRT reduced insulin resistance by 16.4% in men with diabetes or metabolic syndrome. It also improved HbA1c, lowered visceral fat, improved cholesterol, and reduced inflammatory markers. For men struggling with prediabetes, type 2 diabetes, or metabolic syndrome, it is super clear. Optimizing testosterone does what multiple other medications typically can't without all of the side effects that come with them. And the same applies to women. Testosterone optimization in both sexes improved blood glucose control and insulin sensitivity. It's super clear. Now, here's a big one. All-cause mortality. This is one that most people don't believe until they actually hear the numbers. A 5-year follow-up of about 10,300 men on long-term testosterone replacement compared to 28,000 untreated controls found a 33% reduction in all-cause mortality, a 16% reduction in cardiovascular events, and a 40% reduction in new prostate cancer cases. Those numbers are hugely significant. So if you need to go back and hear that again, hear that again. TRT is associated with men living significantly longer and better lives. This isn't fringe science. This isn't influencer science. This is published in peer-reviewed urology and cardiology journals. Now, moving on to women. Women produce testosterone their entire lives. That's always a big misconception. By the age of 40, most women have lost half of what they had at 25, and most doctors don't even talk about it or let alone test for it. And the safety data is super strong. A 4-year study of 900 surgically menopausal women on testosterone showed that breast cancer rates were consistent with the general population, meaning that there was no increase. And they told women for a very, very long time that that was not the case. They told them the opposite, and that study was also completely false. What women do get from properly dosed testosterone is restored libido, sexual function, better energy and mood, cognitive clarity, stronger bones, preserved muscle mass, less abdominal fat, improved insulin sensitivity, and better skin and hair quality. Now, the key to all of this is correct physiological dosing. Women need a fraction of what men do. The goal is restoring normal levels, whether you're male or female, not pushing it past them. Now, as always, there are side effects to talk about. But for men and for women, if you are properly dosed, the side effects are very, very mild and manageable. You have things like hematocrit can rise, and that's why we monitor your blood every few months. And if it does, there are very, very simple fixes. Sometimes you might get some oily skin or mild acne, and that can show up early and usually settles within the first few months. There can be some slight water retention that can happen in the first couple weeks as your body adjusts. Estradiol can rise as part of normal aromatization. When your testosterone levels rise, your estradiol will rise as well. All of this, again, can be managed with dosing adjustments. For women, properly dosed testosterone side effects are even milder than men, occasional acne and stuff like that. Again, this is very dose dependent and it is very reversible. That's why it's so important that you do TRT the right way. It's not something that you want to bro science. It's not something that you want to read off of the internet. You want somebody who understands blood work, who understands what your dosing should be, and you want to make sure that you get your dose dialed in appropriately. So always, 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 always make sure you're doing your blood work with TRT. TRT is one of the safest, most studied, and most effective interventions in modern medicine, which is why Big Pharma doesn't like it, which is why insurance companies don't want to cover it. It's not just safe, it's protective. Better cardiovascular outcomes, better bone density, better metabolic health, better insulin sensitivity, lower all-cause mortality. The risk here is not testosterone. The risk is bad providers who want to give you other medication that is not natural to the body, that comes with a bunch of side effects. And if you run into a bad provider, you do want to look for correct dosing. Pretty simple. Now, real TRT, again, closing point here. is blood work driven. It is individually dosed. It is regularly monitored, and it is adjusted over time. No two patients are the same. And if you ever run into a doctor who tells you anything different, you should turn around and run the other way. When you do TRT the right way, the safety profile is exceptional and the benefits compound year after year